Everything on our shelves, all of the plant material and all our hash oils do have cannabinoid profile on the jars, so the patient can go in and actually see what the medicine has to offer. Just with this cannabinoid profiling we're able to give patients particular strains that's specific to their needs, as opposed to just saying, this looks really pretty and smells really good, try this. We'll start just by grinding up the raw material, getting into a nice homogeneous mixture. I weigh it out and place that into the oven over here, which is just, it's a forced ventilation oven. So there's air constantly moving through it, so it'll hold the temperature at about 35 degrees the whole time, so we're not disturbing any of the cannabinoids that we're going to test, but we're evaporating all the water off of it. Cannabinoids are all the chemicals that have beneficiary properties that help patients. Your THC, your CBDs, and your CBNs are some of the major ones. We'll transfer the dry material into a test tube. We'll add our solvent. The solvent's able to pull all the cannabinoids out because they are soluble in this particular solvent we use. We're able to mix it up with our vortexer here, then place it in a sonicator that's on the other side of the table, and which actually sends sound waves through the water that penetrates inside the test tube that will break open the trichomes and the rest of the plant material, giving our solvent more surface area and better penetration into our sample, extracting more of our cannabinoids out that we're looking, so we get a good accurate representation of our sample. Well, this is our high-performance liquid chromatograph, or an HPLC instrument. We use this to separate our cannabinoids out of our samples. It has a pump that'll run solvents through all the plumbing on here that'll eventually run through a column where we'll make an injection into the column with our sample. So as the solvent washes them through, they'll separate out as our CBDs will come out before our THCs. So we're able to then identify and then quantify what we have. This is basically just a screenshot of what our detector is telling us after we run a sample. You can see the different peaks are the responses to the different cannabinoids coming off the column. There's CBD acid that's right here. I think this one's a chocolate chunk. This strain will have a higher CBD content as opposed to our THC acid, which our peak will show up over here. It's really giving the patients more of an opportunity to know their medicine and know what's in it and what's right for them. There's maybe a handful of labs in the country that are actually doing this right now, so it's a new science, and every day we're learning more and more things to where we can further the medical marijuana industry to benefit patients. And that's really what it's all about, is serving the patients.